When this news hits, it's going to really shake up a number of families, and there are going to be many people who are going to think, oh my goodness, could this have happened to my child, to my kids? And it's a valid and a very important question. And when they talk to their kids, they might want to start off just by saying that, you know, when you've been to the doctor, has there been anything that worried you or bothered you? But they need to follow the child's lead at that time. And so if the child says, no, nothing happened, that it means either nothing happened or perhaps the child just doesn't want to talk about it right now. So they need to leave the door open and say, well, you know, if you think of anything, talk to us or let us know. And maybe revisit the subject again at another time that's comfortable, but don't push on it. Don't make it a big deal. And if their child says, yes, you know, something did happen, and I was bothered by it, be very supportive, and you can ask for whatever details the child is willing to give, and there may be very few, and there may be quite a few. If there are a number of details that come out, sometimes that can be very shocking to parents, and it's important that they not pull back, but that they react very warmly and say, oh, that's, you know, and really support the child in the child's feelings. And if the child says, well, you know, he did this, but it was no big deal, fine. You know, that doesn't mean there's something wrong with the child. That just means that the child wasn't upset by it, and that it just was not a frightening thing, and probably not particularly understood. And so we don't want to miss anything, but we don't want to make a big issue if there wasn't one there. If the child is clearly upset by it, or they are worried that the child is upset by it, then I think that's the time to really seek some professional help and just be supportive of the boy, girl, whatever, and then call generally their primary care provider, if they have one other than a doctor, or call the clinic or one of the people that they know in the community, and get in and see that person and take it from there. Not many of these, in fact, most of these children are not going to need any ongoing treatment, but many of them may need to deal with this problem, and talking to somebody who's trained at dealing with this type of problem can be extremely helpful. Certainly, it's always worth talking to kids about things like this. And then if the kids have questions about it, answer the questions. Answer the questions that the kids are asking, no, not the questions that the parents are thinking, because sometimes children are asking something at a very different level than the parents are afraid. But talk to them about that and answer questions, and perhaps even use that as an opportunity to talk about bad touch, or has anybody ever done anything like that to you, if it seems to flow, and if the child starts coming forward with things, well, no, I've always been happy with the doctor, but that but may be very important, and maybe there's been a teacher or a counselor or somebody that has done something. So it could be an introduction, and it also is a good safety plan, because then you talk to the child when something is actually going on, and that kind of reinforces that this type of touching is completely inappropriate. And so they should come forward, you know, feel free to come and talk to us if ever anybody does anything. But the important thing is to be calm and supportive. You have done nothing wrong. The vast majority of doctors and the vast majority of other of teachers are very good people who are, and it's important that kids have faith and trust. And that's why we do the child abuse prevention programs, to teach kids the type of behaviors that they need to be worried about or that aren't appropriate, and so that they can recognize them and be comfortable that if this is not happening, then I can be comfortable with this person. And talking about the normal physical exam may be important at this time of, yes, we're going to go to the doctor, and the doctor may have to check some private areas, but I'll be there, and he can explain, or she can explain exactly what is going to happen. And I think right now all of us, when something like this comes out, are going to be a little bit more detailed with many of the kids, because they may very well have more concerns than usual. What age range should the questions be asked, and what questions? A lot of it, of course, is individual to your child and how comfortable you are in talking about things. But with younger children, it is more a question of, did anything happen to you that was scary or you didn't like? anything that that made you uncomfortable, and along those lines of not very specific, and if the child really is not bothered by anything, you don't want to go and open up something that isn't there. And then so I'd say the 4, 5, 6-year-olds, that's probably very true of. As they get really into grade school, I think that it's more appropriate to talk about touching somewhat and be ready to go there. Maybe not introduce it, but be ready to go there, and say, was anything scary or frightening, or did the doctor do something to you that you thought was wrong? And kids at that age may very well have a concept of most kids have been taught that you don't let anybody touch your privates, and so and it also may be that some children are going to think, well, yes, that doctor did touch me down there. And in talking to the child, well, what happened, and find out that it was a normal exam. And in fact, it was a normal exam when they were in the room, and that now it's become a little bit scary to the child. So following with that, as kids get older, certainly into late grade school and on, then I think you can be a little bit more definite in saying, was there anything, did he touch you or do anything to you that really made you uncomfortable? And really be a little bit more specific and probing, and just follow the questions from there. And as the kids get older, you can certainly be a little bit more blunt, perhaps, and they're more likely to come forward on their own. And also, I think parents need to look back and to ask themselves, did we go to the doctor and leave and the child seemed upset at some point? Now, that by itself may not mean anything, because if a child gets a shot, they may not want to come back to the doctor. Or if I do a throat culture, a child may be very upset with me, and that's not the same thing. But it's important to probe it, and why were you worried or upset? And interestingly, I think that there are probably going to be some parents that are going to find some other things that are not abusive, but are just that maybe they find somebody with a better technique or who gets along better with their child.